When Target Aid exposed why the annual checkup you thought was free might actually cost you, we heard from a lot of frustrated patients. The way you're billed for health care has long been a mystery. Well, Target Aid's report last spring on surprise bills for annual checkups prompted Spectrum Health to step up efforts to increase billing transparency. Target Aid investigator Susan Samples circling back tonight to find out what providers are doing to warn patients about the potential for a checkup markup.
Since the Affordable Care Act requires insurers to fully cover your preventive care, you expect that annual routine checkup to be free. But recently, Target Aid heard from yet another patient who was surprised to find out that's not always the case.
It was incredibly annoying.
It's also a sensitive topic. This man didn't even want to be identified, worried no one would take a patient who complained to Target Aid.
And unfortunately, we're in a industry where the consumer doesn't have a voice. Once you get that bill, you get that bill.
The bill he got for an annual checkup he thought was free, $83. The reason, he'd asked if some minor bowel irritation he'd been having might be stress related.
And my doctor said, yep, it's probably stress, but I would also lay off the dairy. And that was the extent of our conversation.
How long did that take?
Less than 30 seconds.
But that 30 or so seconds cost him $83 because his doctor counted it as a second office visit.
And in all honesty, that makes me reluctant to be forthright with any conditions that might result in another charge.
The mere discussion with your doctor of a new symptom can cost you more.
That can.
How is that fair?
Yeah, it's complex, obviously, and a challenge, I think, for all healthcare systems industry-wide.
Spectrum Health was eager to talk about how it's increasing billing transparency.
Do you understand why patients are so frustrated?
I do, and I think that's where the obligation is on every healthcare system to have that conversation with the patient as early as possible.
Spectrum Health.
That's why if you call Spectrum Health these days to set up your annual checkup, the scheduler is required to tell you, it's actually scripted, that a complete physical is considered a preventive visit. Discussing a new or unstable chronic condition is not covered as part of the annual physical and may result in additional charges. Mercy Health schedulers give a similar speech, and Metro Health says it's currently examining its process for annual wellness checks. Spectrum also places this brochure at front desks in waiting and exam rooms. It lists items not covered in routine checkups. Discussions about abdominal pain, fatigue, irregular periods, and joint pain might cost you extra.
Even if it's a 30-second conversation?
Yeah, they don't go into the length that, the time length of the conversation.
Doctors are paid by insurers based on billing codes they submit. This is a book of them created by the American Medical Association, and doctors have to follow these guidelines if they want to get paid.
The book says doctors should submit an additional code if, during the annual physical, they also perform a significant, separately identifiable service, and that's what will cost you.
Who decides what's significant?
Again, it goes back to the industry standard guidelines provided by the American Medical Association.
While Spectrum acknowledged coding standards are subject to some interpretation, Dr. Kristen Brown of Mercy Health went even further.
Whether a patient is charged extra depends on what doctor's office they happen to be in.
Unfortunately, I have to say yes.
Brown oversees hundreds of doctors as president of Mercy Health Physician Partners.
Because there is some leeway, doctors aren't always clear on what that cutoff is either. And it's fraudulent for doctors to not charge for the work they're doing or to overcharge.
Case in point on conflicting interpretations. Remember this man's brief back and forth over his irritable bowel? Brown doesn't think she would have charged for it.
If that's the end of the conversation, to me, in my opinion, it doesn't sound like that should be charged.
Mercy and Spectrum both say doctors are using their own best judgment, trying to comply with complicated coding requirements, get paid for their time and expertise, stay on schedule, and keep up with piling paperwork outside the exam room. Endless requirements of a complex system doctors want to see simplified. On that, patients agree. This one, who wouldn't name what health system charged him extra, wants to get back to basics.
We're stepping away from, having actual discussions with our doctors, how we should.
Patients don't want to bring up problems because they're afraid it's going to cost them.
Yeah,
Is that a problem?
I think it's a huge problem.
Healthcare providers urge you to talk to the scheduler when you call to set the appointment. Tell them what you want to cover in the annual exam and ask if it's going to cost you more. If you're still concerned, talk to the front desk person when you get there, or even the doctor in the middle of the exam. Say, Dr. So-and-so, I want to talk about this, but I want to know if it's going to cost me more, and do you think it's worth it? I'm Target 8 investigator Susan Samples.